She got a really bad recessed vulva. So this is what we call a recessed vulva, or a hooded vulva. If you look, it's kind of surrounded by skin folds. You can't really actually see it, but if you push upward, you can see the complete vulva. So yeast and bacteria can live inside of here, get into the vaginal tract, go upstream to the bladder, and cause a urinary tract infection. So not sure if this is the first UTI or if she's had them for quite some time. The bacteria also changes the pH of the urine and start allowing stones to form. So she could have bladder stones as well. I'm gonna try to get some urine from her. So for a urinary tract infection, we typically get a urine sample to do a urine analysis. We call that a urinalysis, to see if there's any bacteria or crystals in the urine. But when we can't get a sample, that's quite difficult. It does not look like she has a bladder at all. So the options we have is to keep her here and monitor her until she develops a bladder so that we can get a sample, or just treat for a UTI blindly. When they don't have any urine in the bladder, it's very difficult to see if they have stones with the ultrasound. So the next step ultimately would be to take an x-ray and kind of go from there. So this baby actually urinated multiple times in the car because she just can't hold it. I'm sure she has a itchy sensation that's causing her to feel like she has to urinate. So if your baby is having accidents in the home, urinating multiple times inside, they may not necessarily be being disobedient. They could have a urinary issue. So just make sure you book an appointment, because we can test their urine to make sure they're not just being disobedient, and ultimately they may have a medical issue.